Hello, everybody. This is Dr. Stuart Fishbein on the day following the Super Bowl. I hope you had a great weekend. I'm here today to talk about ACOG, the American College of OBGYN, and specifically a post that came out this week talking about, are you an immunization champion? And I'll get to that in a second, but I want to back up because I think the American College of OBGYN, even though they talk about informed consent, they talk about shared decision making, I think that's word salad and not necessarily what their mission is. I think they've lost their way. The lucky thing we have in 2025 is free access to information. There's less censorship on the internet than there used to be, and you can find alternatives to pretty much every option that you have. And then you have the right, at least as an American, to make an informed decision and decide whether to consent to something or to not consent to something. ACOG is supposed to honor that. Matter of fact, ACOG has guidelines out, probably one they don't follow as well, which talks about the fact that any sort of coercion, whether it's subtle or overt coercion, is ethically unacceptable. And yet you'll see posts like I'm going to talk about in a second that sort of violate that tenet. My ACOG history goes back to when I was first finishing my residency. You have to then get your list together. You have to take your boards in OBGYN. And once you pass your boards, you can apply for fellowship in the American College of OBGYN. I was very honored at that time to be accepted as a fellow. It was the pinnacle of being an OBGYN. I invited my parents out at the time. It was in Las Vegas. We wore cap and gown. It was a big deal. And I was very proud of being a member of ACOG at that time because I only knew what I knew. And as the years went by and I began to change the way I looked at obstetrics because of my collaboration with midwives and how they taught me a whole nother way of doing things, I began to awaken to the fact that ACOG is more of an industrial lobby. ACOG is about controlling the narrative. Because if you look at the history of obstetrics over the last 50 years, and we've done this before, the C-section rate in 1970 was 5%. Right? The breech deliveries, twin deliveries vaginally were considered normal. Forceps was taught as a skill to help babies that needed it, and it was probably overused, like many things. Any interventions become overused. But nonetheless, with a C-section rate of 5%, and then you look at the morbidity that occurred at that time. And the endpoints are often in most scientific papers on obstetrics and gynecology, they're looking at neonatal morbidity, neonatal mortality, and often C-section rate or maternal morbidity. And if you look at those things and you look at neonatal morbidity and mortality over the last 50 years, it really hasn't changed. Yet C-sections have gone up. Vaginal deliveries have gone down, obviously. We have increased postpartum depression. We have increased maternal complaints of obstetrical trauma. We have increased chronic disease in our children, which I do believe is multifactorial, but I believe our immune health begins in the womb. Over these last 50 years, we've had multiple interventions. We had a C-section rate of 5% when we had no fetal monitoring. Then we brought in fetal monitoring, we brought in the Friedman curve, and interventions went up based on these flawed systems, which is another reel for another day. And we brought in interventions and we brought in fear. And coming out of that fear were guidelines and control put out by the American College of OBGYN. The guidelines that they put out, first of all, I just want to reiterate that in their own journal, the Green Journal in 2010, they had a paper that came out that said that 2/3 of their guidelines are based on consensus opinion. And when you end up with consensus opinion and everyone who's giving an opinion thinks the same, it's not really a consensus. It is really just an agreement. I hesitate to use the word cult-like, but residency and OBGYN is a cult-like experience because you follow the rules, you follow the guidelines that are set forth by your program, and if you question anything, you are beaten upon. You're labeled a heretic, and so people just keep their head down. As a matter of fact, I don't think that a lot of independent thinkers want to go into medicine anymore because they find it's very robotic and very algorithmic. And then ACOG will put out guidelines, and doctors and hospitals will choose the guidelines they want to follow, and they'll ignore the guidelines they don't want to follow. Now, that's fine. That's free to do that. But then if someone else outside of them chooses not to follow a guideline that they follow, they consider that to be negligent and malpractice, and they make it very difficult. But what we're supposed to do is we're supposed to give information, and we're supposed to let our clients decide. And we are free in this country as physicians and midwives to give our opinions, which is really interesting because yesterday I listened to a podcast by my friend Melanie Jackson called The Great Birth Rebellion, and she did an excellent dive into respiratory syncytial virus and then the vaccines. But one of the things that struck me about her disclaimer at the beginning and at the end was that she's not allowed by her registration in Australia to give an opinion about vaccines if it differs from the government's opinion. We don't have that here in the United States. So ACOG is supposed to be this paragon of virtue. They're the ones that are supposed to be telling us what's right and wrong in our profession. But I just want to refer to a couple recent posts. And their priorities, they don't seem to be open to discussion. They don't like to be confronted with their decisions. I, as a matter of fact, recently reached out to a maternal fetal medicine specialist who I knew from my days at Cedars-Sinai in Los Angeles about something he said about the COVID vaccine and how appropriate it is to give to pregnant women. And I asked him for any data on that, or asked him to come on the podcast, and he refused to do that. Well, recently they had a post that just said, skipping periods is safe and normal. Talk with your OBGYN and learn more. Right? Now, it may seem inane. It may seem like, well, what's the big deal? Birth control pills are one way to, they're talking about birth control pills, obviously. But since when is skipping periods normal? It's not normal. It's artificial. And is it safe? I would argue that I used to think it was safe. I wrote birth control prescriptions for any woman teenager who had irregular periods or painful periods. It was the first line. We never bothered to look for the root cause. We only just wanted to solve the problem by giving them birth control pills. And they would take something for 20 years, which was great because it kept them quiet, and it was great because it made the pharmaceutical companies a lot of money, and that's what we were taught. And we were taught that this was normal, but it's not normal. And these are the kind of things they put out. And then just the one that inspired me today to come on and do this reel was at ACOG_org, which is their Instagram handle, put out a meme that says this: are you an immunization champion? ACOG is recognizing OBGYNs who go to the extra mile to vaccinate pregnant patients and improve access to maternal immunization. Nominate a deserving champion today. And then they go on and they say nominations are open for the 2025 Immunization Champion Award. And this award honors physicians who have the highest percentage of their patients who get vaccinated. Now, they're not just talking about the COVID vaccine here. They're talking about the flu vaccine, the DTaP vaccine, and the COVID vaccine at 28 weeks. And they're talking about the RSV vaccine at 34 weeks or so. And the reason RSV is delayed is because there's an increased risk of preterm labor with it. It's small, but it's an increased risk. So you always have to look at risk and benefit. And I would tell you, if you really want to know about the RSV vaccine, go back and listen to Emily's podcast on the Great Birth Rebellion. But the thing about the vaccines being given all at once is that none of them have ever been really tested for safety in a randomized placebo-controlled trial in pregnant women. RSV, they've done a couple of studies, both of them, by the way, really done by the pharmaceutical companies. But not only have they not done testing on the individual vaccines, but they're telling you that it's safe to give 5 vaccines at the 28-week visit. How do they know it's safe? How can they even say such a thing? And ACOG is all in on this sort of thing. I'd like to make a note that if you're going to be somebody who's giving out guidelines, you have to have trust, and you can't have conflicts of interest, and you can't be compromised. And yet ACOG, it's reported that they took millions of dollars from the NIH to promote the COVID vaccine in pregnancy during those first few years of the COVID pandemic. So if you're an honest broker, you can't be taking money to promote something. You can't do that because the appearance of impropriety ruins everything. And now they want to award physicians, which, by the way, is a form of coercion, to give awards to physicians who give the most vaccines. Vaccines that, again, I will say, have never been tested for safety. Most of them against diseases that aren't very morbid. Yes, some people will get very sick from the flu. Very rarely will they get sick from COVID anymore. Diphtheria, not really something you worry about. Tetanus in a newborn, and giving to a mom to give to her newborn, by the way, which contains aluminum. I think 400 micrograms of aluminum in that. And then pertussis, which has some morbidity to it, but it's very small, and you need to take a dive. This is not the real to do it. Take a dive to look into what's the real risk to my healthy baby in a first world country of getting any of these diseases so bad that my kid has to be hospitalized or worse. Right? That's not something that's ever considered when ACOG puts out these guidelines. I don't get pleasure out of ragging on ACOG, but I think ACOG, in the time of Make America Healthy Again, and where we're looking at toxins in our environment and in our food and trying to make things healthy again, ACOG should be at the lead of this in pregnancy, because as I said earlier, I do believe that our immune health begins in the womb, and how we birth matters. And the babies that go through labor, that get colonized with mom's bacteria, that get skin to skin immediately, that get delayed cord clamping, those babies do better. That's opinion, but it's based on evidence. So again, the evidence is out there on the internet to look for. I'm just saying that I don't believe that ACOG is somebody that is now relevant to the discussion anymore. Until they make a course correction, which I don't see happening again, because everyone in ACOG that runs it loves what they're doing. And so it's very hard for systems that work like that to make change. So just take what ACOG says with a grain of salt. And when your doctor says that they're following ACOG guidelines, ask them why they don't follow the guidelines that say breech vaginal delivery is a reasonable choice, that vaginal twin delivery is a reasonable choice, that VBAC after one, VBAC after two, and even possibly VBAC after multiples is a reasonable choice. Ask them that, because they're going to quote guidelines here, they're going to ignore guidelines there. It's all inconsistent, and I just think that we need to start over and take another look at where we get our information from. And ACOG, if this gets referred to you and you're listening, I'd be open to having anybody from ACOG come on the podcast or just one-on-one with me and have a conversation about why you're doing what you're doing, because it's not working. All you have to do is look at the outcomes. Thanks everybody for listening.